Welcome to our Wiki page, Project on Addiction. Hi, I'm Yasmina Jerez. Helping me present are my fellow group members, Usman Chaudhary, Karen Medina Reyes, Calvin Pinero, Adriana Martinez, and Tyler Seward. Together we will share some facts on addiction, causes, effects, and stigmas. Continue on key techniques from positive psychology that complement cognitive behavioral therapy. This may be a solution on treating this disease, followed by some techniques using positive psychology to help treat, prevent, and guide you through recovery. Let's talk addiction. In our society today, people are struggling with a wide array of different disorders and diseases. However, there is one that is very rampant and affects a lot more people than one might think. An alarming number of people, both young and old, are becoming addicted to various substances such as alcohol and drugs. When talking about substance addiction, it could be defined as a chronically relapsing disorder characterized by compulsion to seek and take the substance, loss of control in eliminating intake, and when access to the drug is denied, a negative emotional state emerges. Here we will share several factors that can help how a person can develop an addiction and why it may be difficult for them to overcome it. The reason does not mean that they are a lost cause and that nothing should be done to help them. For humanity and our country, it is the utmost importance that there is an intervention in place that can be used to help those who are trying to overcome their addiction problems, and education provided for prevention measures. 21 million Americans have at least one addiction. Addicts utilize drugs or participate in obsessive activities which they frequently continue despite negative consequences. Addiction prevention and treatment measures are often as effective as those for other chronic disorders. Only 10% actually receive treatment.
Hello, my name is Usman Chaudhary, and I will be talking about some of the causes of addiction. Addiction is a treatable and a chronic medical disease. It involves interaction between brain circuits, the environment, genetics, and an individual's life encounters. The first cause of addiction that we'll be talking about are brain circuits. Brain circuits alters how an individual chooses decisions among behavioral options. The reward, memory, motivation, and control circuits all have a systematic impact on these addiction decisions. A network of four circuits involved in drug abuse and addictions. First, there's the reward circuit, which is located in the nucleus accumbens and the ventral pallidum. Next, there's the motivation or drive circuit, which is located in the orbitofrontal cortex and the subcallosal cortex. Next, there's the memory and learning circuit, which is located in the amygdala and the hippocampus. And lastly, there's the control circuit, which is located in the prefrontal cortex and the anterior cingulate gyrus. During addiction, the drug's increased value in the reward, motivation, and memory circuits overcomes the prefrontal cortex's inhibitory control, favoring a positive feedback loop initiated by drug consumption and is sustained by increased activation of the motivation or drive and memory circuits. Another possible cause of addiction could be an individual's environment. Environmental variables that lead to drug and alcohol misuse, particularly among young adults, might include peer pressure, from peers and or family members, social media influences, culture, and stressful life events or transitions. These factors may increase a person's risk of exposure to drugs and alcohol, which in turn can lead to them developing an addiction. For adolescents, parental modeling may be a cause. Seeing addiction in adults around them and in their life can foster this behavior as being normal. A third possible cause of addiction could be a person's genetics. Substance use disorder is often handed down via families. This is due to the fact that it has a genetic component, which means it may be handed on from parent to child via genes. As a result, your family history may reveal how vulnerable you are to addiction. According to studies, the strategy entails analyzing complete genomes for areas of genetic variation known as single nucleotide polymorphisms, or SNPs, that are linked to the same illness, problem, condition, or behavior in several persons. Researchers employed this strategy in the study to identify parts of the genome related with overall addiction risk, as well as the risk of drug use disorders. The strongest gene signals consistent across diseases were found in parts of the genome known to affect dopamine signaling regulation, suggesting that genetic variation in dopamine signaling regulation rather than dopamine signaling itself is important to addiction risk. And this is from the US Department of Health and Human Services, 2023. The fourth and final cause of addiction that I will briefly talk about is an individual's life encounters. Unexpected experiences individuals may face can lead to trauma, which then in turn can lead to them developing an addiction. Uh, an individual's experiences during childhood, such as physical, sexual, or verbal abuse, may lead to addiction. It was found that 90% of women who were addicted to alcohol were sexually abused as a child. And history of military service has shown there to be higher chances of individuals self-medicating with drugs or alcohol. Now I will pass it on to Karen, who will talk about the effects of substance abuse, as well as the stigma surrounding addiction, and give an introduction to the idea of positive psychology.
Good afternoon to all. My name is Karen Medina Reyes. To start off, I'm going to be speaking on the effects of substance abuse. Primarily, it is going to be your health. This is because people with addiction have one or more associated health issues. Many of these can cause lung or heart disease, strokes, cancer, even mental health conditions. Moving forward, of course, in the long term, it's going to affect your family and your friends. This is because the effects of addiction, they can be both short and long term. So happy and peaceful, loving families, they can be wrecked resulting from this drug and alcohol addiction. It can cause loss of trust. It can create broken relationships. Marriages, they can break due to changes resulting in addiction, It can be an inability to recognize loved ones. Maybe if they've gone that far, they can't even recognize the ones they love. They have estrangement and many other factors. It can obviously affect future productivity. This is because anything you do intake in your body can affect any future generations, especially for the women if they're carrying. Of course, it burdens on the community. There are many reasons to this as well. This is because drug abuse affects a society, and it can increase violent crimes, drug-related accidents, and many effects on drug abuse. The health, the increased cost to reduce the rate of drug abuse affects the society and the economy. So that's another factor. And lastly, simply just death. It can lead to a factor when someone's so far into the drug addiction that the health conditions just get severe and worse that it can result in death, unfortunately. Stigma with addiction. So, when it comes to the stigmas with someone that has an addiction, they're usually called a junkie, stoner, alcoholic, crackhead, all dismissive terms commonly used to describe people with substance abuse, often viewed more negatively than mental illness. When we regard addiction as a moral or criminal issue, we neglect a public health issue, putting a barrier on recovery and treatment. People with substance abuse disorder may face mistreatment, stereotyping, and negative bias from society, including a healthcare setting. It may lead them to avoid seeking medical help. The reason this happens is because individuals may experience shame based on addiction stigma. To conclude this whole slide, basically, when one needs help, they may hesitate in order to seek it and find it. The reason is because they are ashamed of what they are going through due to society and the stigma that it has. The words that are used are often mistreatment, how we stated in the first bullet point. Nobody wants to be titled any of these names, so they won't go seek help because they are embarrassed. They don't want to go through it. And instead of the society making it better, basically, we don't take action towards it. There's kind of more stigmas than help in the end of the day. Moving forward, positive psychology often is connected and plays a huge role when it comes to addiction and to substance abuse. This is because it is a positive mechanism that is often implied to help one who is going through addiction in order to find light and focus on their strengths. Positive psychology is a therapeutic approach that's relatively new, and instead of focusing on what's wrong with an individual, it tries to focus on the good and positive things an individual has, which could be strengths. So, what is positive psychology? Positive psychology is a very short history with a very long past. Dating back to only 1998, positive psychology could be defined as the scientific study of what goes right in life, from birth to death and all stops in between, according to Peterson. Although named not too long ago, the practice is clearly actively in psychology history. Another view on mental psychology that it puts its focus on one's happiness, character, and purpose, using human characteristics to their advantage, focusing on living a healthy lifestyle and focusing on their strengths. In order to understand positive psychology, it can be summarized into what Peterson calls the 3 pillars of positive psychology. The first one would be positive experiences. This is basically with every positive experience one has had in their early days. The next one would be positive traits. So positive traits include characteristics such as being courageous, kind, to be curious, cooperative, many things like that. And the last one would be positive social institutions, which is basically everything that's around us, from family to relationships to work. It's just about the environment and the positivity of when you're around it.
Hi, my name is Kelvin Pinero, and I'm moving toward a solution our group has a main interest in against alcohol addiction. This is cognitive behavioral therapy with the help of positive psychology concepts. What is cognitive behavioral therapy, or CBT for short? Cognitive behavioral therapy is the act of a trained therapist that can help you think differently about your experiences and your relationships. This is with the intention to make some positive changes in your life with accordance to the reason for attending. Cognitive behavioral therapy emphasizes the idea that how we think, how we feel, and how we act are all closely related. This helps in allowing a focus on improving well-being across behavior and emotions with the context of those interconnected interactions. Social environments that cognitive behavioral therapy pertains to can be in individual settings with one-on-one therapy sessions with a behavioral therapist, as well as group settings with a generally small group of individuals with similar issues or behaviors. Now, moving to how can cognitive behavioral therapy help with addiction? Cognitive behavioral therapy allows for a safe and non-judgmental environment where people can talk about their addictions as well as the various effects it may have on them. This can help towards the process of identifying any negative or unhealthy thinking causing substance dependence. It can help with retrieving the self-awareness on how negatively their addiction is affecting their life, having an individual recognize feeding into an addiction is going to do more harm than good, and then taking the necessary steps to cut them out of their life. There is also a purpose to change the unhealthy types of thinking by creating methods on how to properly reconstruct the patterns of negative thoughts leading to thinking. This can aim to teach those with addiction ways to recognize triggers, associate and strategies with addiction to alcohol, as well as how to solve it, since awareness provides a way to manage the cravings behind addiction towards drinking. There is also a use in positive self-talk with ways to build self-affirmation in oneself to allow for self-control and boost self-esteem to the path of recovery. And a large focus is on coping skills and a way to deal with triggers that may lead to drinking and turning them into a healthy, sustaining alternative with better self-management strategies. This type of intervention specifically is beneficial in treating addictions because it brings in an unbiased third party to facilitate and help individuals figure out what problems may have come from their addictions that they may not have noticed, as well as the long-term consequences that can come from being an addict. This can provide a helpful realization since bias can usually get in the way of advice or the ability to trust what a person is saying to you. With an unbiased professional perspective, a person may be able to see the objectivity within the issues of their addiction. Cognitive behavioral therapy is a great intervention that can be used to help an addict overcome their addiction regardless of their age or background. However, a particular population that would benefit greatly from this intervention would be younger people. Young people are a subset of a population that is most susceptible to substance addiction. To reiterate my earlier points, cognitive behavioral therapy can help with addiction in a variety of ways, and with those variety of ways, we focus heavily on the thinking of the individual and how they can attack cravings and the desire to want more alcohol. So it creates an environment where we can fight addiction and help save people from succumbing to alcohol addiction more, as well as other addictions that they may be suffering with. Now I'm going to pass it to Adriana, where she will talk more about the intervention between CBT and alcohol addiction.
Hello, this is Adriana Martinez, and I'm going to discuss implementing the intervention. Addiction treatment can be greatly improved by combining positive psychology concepts with cognitive behavioral therapy. The goal of this intervention is to help caregivers and therapists deliver successful cognitive behavioral therapy to people who are addicted to substances. It provides a step-by-step method for assisting people in addressing their addiction, establishing a secure and encouraging environment, teaching them about the negative consequences of substance abuse, investigating the underlying causes of their addiction, identifying coping mechanisms, setting realistic recovery objectives, and keeping up a positive, encouraging, and closely watched recovery path. Step 1 in this intervention is creating a safe and non-judgmental environment. The first step in helping young people recover from substance addiction is creating a setting that is secure and judgment-free and fosters open communication. This is a crucial step in laying the groundwork for trust, which is necessary for therapy to be effective. The main goal is to cultivate an environment where the person feels comfortable sharing their ideas, feelings, and experiences while also encouraging open communication. So first, within that, creating a safe and non-judgmental environment, the first step is the assessment. You want to evaluate the person's particular substance addiction, its level of severity, and any underlying problems that may be causing or exacerbating the addiction. We want to establish trust. So to establish a judgmental-free a judgment-free environment, and cultivate a therapeutic connection based on empathy, understanding, and trust. We want to assure confidentiality. Stress the value of confidentiality in order to help the person seeking therapy feel comfortable opening up about their ideas and experiences. And also, it's important to encourage comfort, making the counseling environment cozy so that the patient is relaxed and prepared to talk freely about their issues. Step number 2 in the intervention is teaching people about the negative consequences of addiction. It is imperative to handle substance addiction with a multidisciplinary approach that emphasizes both prevention and recovery support. Prevention is greatly aided by education, particularly for the youth who are most susceptible to the negative effects of substance misuse. We begin educating the public about the negative effects of substance addiction in step 2 of this process. Psychoeducation. It's critical to have discussions with young people about the short and long-term effects of substance abuse. Age-appropriate and audience-resonant materials should be used for this. We hope to convey to young people the seriousness of their decisions and the potentially devastating ramifications of substance usage by outlining these repercussions in an approachable and realistic way. By taking this step, they gain knowledge that will empower them to make wise judgments. Brain development. Talking about how drug abuse can harm a person's developing brain is essential when teaching youth about the dangers of substance addiction. The introduction of narcotics can affect the cognitive and emotional functioning of the teenage brain, which is still developing. By elucidating this, we assist youth in seeing that the decisions they make now may have a lifelong impact on their capacity for thought, learning, and emotional regulation. Knowing this can be a very effective way to discourage drug experimentation. Impact on life. Addiction to substances has a profound effect on a person's entire existence, not simply their health. It is imperative to communicate the wider ramifications of addiction, such as the damage it may do to one's relationships, changes of success in school or the workplace, and general quality of life. We teach young people that their decisions have far-reaching effects by talking about these practical repercussions. Being conscious of this can be a powerful incentive to withstand the pull of substance abuse. It is beneficial to include mindfulness and relaxation techniques in preventative programs. Step number 3 in the intervention is exploring root causes of addiction. Effective intervention and prevention of substance abuse requires a thorough understanding of the intricate web of factors that contribute to addiction. We explore the third step of our methodology in this section, which is investigating the underlying reasons for addiction in young people. This step's main objective is to obtain an understanding of the fundamental causes of substance dependence. By identifying the underlying reasons, we can modify our interventions to target the particular problems that lead to addiction. First, you want to have an open discussion. Young people should be encouraged to communicate their experiences, feelings, and views without a fear of judgment or condemnation by providing a secure and welcoming environment. By being transparent and allowing for vulnerability, this open discussion paves the way for us to understand the underlying causes of addiction. We also need to identify triggers. A crucial component of this phase is comprehending the causes and motives underlying substance use. We help the people explain why they first went to drugs or alcohol in the first place and what keeps them using continuously by utilizing open-ended inquiries and reflective listening. It is important to understand the emotional, social, or environmental elements causing addiction by examining these triggers. We also really want to dive into family and peer dynamics. A young person's life is greatly influenced by their ties with their family and peers. Examining these relationships can provide important insights into factors that may have contributed to their education. We look at the dynamics, relationships, and family environment to see if there are any causes of stress or contributing factors. And finally, step 4 in the intervention is understanding consequences and developing coping skills. This combined step aims to help the person understand the negative consequences of their substance abuse, equip them with the healthier coping skills to manage emotions and cravings, and integrate positive affirmations to reinforce their journey towards recovery. During this stage, young person is provided feedback on how their addiction has affected their life and helps them make the connection between their behavior and the unfavorable outcomes it has caused. The mission is to increase understanding of the causal relationship between addiction and the damage it does to one's relationships with others, one's bodily and mental health, one's opportunities for education or employment, and one's general quality of life. First, again, is the skill assessment. We want to first assess the current coping mechanisms and investigate potentially more advantageous ones. It is important to be able to customize coping mechanisms to each person's particular needs and situations thanks to this assessment. Next, we want to investigate emotional regulation. We provide instruction in stress reduction, mindfulness, and deep breathing, as well as other emotional regulation techniques. With the use of these strategies, a person may better control their emotion reactions, which lessens the need for drugs or alcohol as a coping method. Alternative behaviors are also something that should be investigated. Rather than just using drugs or alcohol, the strategy is to promote participation in uplifting and joyful pursuits. We help the youth refocus and discover healthy outlets for their emotions and cravings by highlighting the adoption of alternative and productive habits.
Hello, everyone. My name is Tyler Seward, and I'm here to talk about our intervention. So, for our intervention, we decided to choose cognitive behavior therapy focused on positive psychology to help our clients battling alcohol addiction. So, we chose positive psychology specifically to go with the cognitive behavior therapy because the positive psychology increases the efficacy of cognitive behavior therapy, and the positive psychology also allows our individuals to focus on developing positive emotions, understanding their personal strengths, and having a better overall well-being. We believe that this mixture is a comprehensive approach to addiction treatment. Techniques in positive psychology within cognitive behavioral therapy. So there's lots of different techniques that we can use to help change the way of thinking of our client. The first one is having them keep a gratitude journal. So a gratitude journal is when an individual has a daily list of just what they're thankful for in their life, what they're grateful for, what they're appreciative on a daily basis. The strategy fosters satisfaction and reduces the need for alcohol as a coping mechanism in these individuals' lives. Because we know that for people who are battling alcohol abuse, they use it as a coping mechanism. Lots of them use it as a coping mechanism for lots of underlying issues. So when we keep a gratitude journal, it'll increase our clients' happiness and put them in the right direction. The next technique in positive psychology that we will be using is mindfulness and relaxation exercises. Mindfulness and relaxation exercises are very good at calming the mind and helping clients develop that mindfulness with a greater feeling of inner peace and overall well-being. Different mindfulness exercises are some like yoga. Yoga uses meditation where you can focus on your breaths, taking long breaths into your nose, where you blow out slowly through your mouth. This is a natural way of your body to create serotonin and have a natural, happier day, life, interaction, everything. Unlike what some call negative psychology, positive psychology is a strength-based approach. Some of you may be saying, what is a strength-based approach? A strength-based approach is an approach that focuses on the strengths of an individual rather than their weaknesses. So, in positive psychology, we want to help our clients identify and utilize their own skills. This way, we will allow them to form a better sense of self-efficacy and confidence in their overall abilities as a human being. That way, their ability to cope with alcoholism is better, and just their overall ability as a human. So the last technique that we will be using with our client under positive psychology is positive affirmations. There's a quote that says, a positive attitude changes everything. That means that the more we think positively, the more stronger our neurons are, our neural pathways are to form those positive thoughts. And all it starts with is speaking that positivity into existence. So our body is familiar with those positive feelings and thoughts. So with positive affirmations, we can include them in the cognitive behavior therapy sessions to promote self-worth and increase self-esteem. Like I said, they counteract positive self-talk and promote a more happy and sympathetic mental conversation within. Our hypothesis. So the intervention that we chose is cognitive behavior therapy, focused on positive psychology. So when we mix these two components together, it not only tackles the behavior and cognitive elements of addiction, but also improves emotional well-being, resilience, and self-esteem of our client. By using cognitive behavior therapy's evidence-based procedures, we will be able to help our clients not only conquer addiction, but also live healthier, more satisfying lives without becoming reliant on drugs or alcohol. Those of you who have listened and paid attention to our presentation, I want to say thank you, and I hope you enjoyed. And